There are 246 additional cases reported in today's numbers. They're all locally acquired. 90 of those cases are linked to known outbreaks and other cases. The rest are under investigation by our public health team. I want to make a couple of comments in relation to some reporting last night in relation to vaccines and Victoria's fair share. And I don't do this with a sense of anger, although Victorians would be excused for being quite angry. But anger won't fix this. Only a change in policy from the Commonwealth Government will fix and remedy this for the future. I signed up to a national plan to vaccinate our nation, not a national plan to vaccinate Sydney. We have seen hundreds of thousands of vaccines that should have come and should now be in the arms of Victorians going into Sydney, into GP practices and into New South Wales. Now, I have been very clear all along the way. Some extra allocations, well, we don't begrudge that. Sydney are in a very difficult set of circumstances. But they were known. They were announced. This was not announced. This was done without anyone knowing. And the Commonwealth have got caught doing it. But there's something like 340,000 doses that have not come to Victoria that ought to have. That would mean we were closer to 70%. It would mean we were closer to 80%. It would mean we were closer to ending these lockdowns. That's as constructive and as clear as I can be. Getting angry about it won't fix it. Only the Commonwealth Government can fix it, and I would anticipate Minister Hunt, who's got quite a lot to say, quite often, had a lot to say last year, for instance. I would hope that he would sit and answer all your questions about how this has unfolded and how he's going to remedy it. Now, some don't like to see this as a race, but a race it surely is. What I didn't know was that Premier Berejiklian's in a sprint while the rest of us are supposed to do some sort of egg and spoon thing. No, we want our fair share. These allocations, which are totally unfair and were under the table, need to stop, and we need to get a make good. We need to get those doses that we didn't get fast-tracked to us. Our state hubs are doing an amazing job. Those GPs that are accredited and have got supply, they're doing a great job too. Only problem is there's a lot more of them been accredited and fully supplied in Sydney at the expense of everybody else. That's just not fair, and I would not be doing my job if I didn't call that out.